So, audience, session number 3, welcome back. My name is Sascha Bukrov. I'm the Senior Manager from Marine Medical Solutions. And let me introduce our guest for this third session. It's Ms. Silke Schatzle. Maybe Silke can tell us about you something.
Hey, yeah, good afternoon to the audit and good afternoon to every listener on the screen. And thanks for the invitation. I'm very pleased to take part today. My profession is pharmacist. And before I joined MMS, I've been co-owner of a big German shipping pharmacy for almost 20 years. We have delivered medicines and medical equipment to all kinds of vessels around the world. And so I'm familiar with the most current medical stores regulations and can say for 20 years, my job has been all around health at sea.
Thank you very much. The next guy in the round is Dr. Joachim Pritzbur. Would you also introduce yourself?
Yes, thanks, Sascha. Thanks, MMS, to be here again. My name is Dr. von Pritzbur. As you said already, I'm a ship's doctor. I was working for the German cruise industry for the last 15 years. I was not only doing the job on board, I was also involved in new buildings. So we designed hospitals and thought about the special need of what to bring on the ship, how to react in a different environment. So since then, I'm very interested in non-medical vessels, so cargo ships who has no medical staff on board, to support them from shoreside with telemedical assistance.
Thank you very much, Joachim. And last but not least, Dr. Jens Tölzner, CEO and President from Marine Medical Solutions. Please introduce.
Very good afternoon, audience. I'm pleased to be here again, and I'm happy that you joined us for this third session again. Yeah, as I said, my name is Jens Tölzner. I have a career of more than 20 years in hospital, specialized in emergency medicine and intensive care. I was responsible for Europe's biggest cruise ships group for a couple of years from the medical perspective, and have founded Marine Medical Solutions as a company and have the honor to work with this fabulous team. And Sascha, you as a moderator have been followed the question that came in during the last 2 sessions. Let's get started, I think.
Yes, perfect. So, yeah, during the day, I received a lot of questions from our audience via mail and with the Q&A section. So let's start, because we just have 30 minutes time. And the first question is for Dr. Joachim von Pritzbur. Joachim, we discussed different kinds of support possibilities this morning. I received a question about where's the difference between TMAS and MMS?
Okay, that's a very good question. TMS is a very old and established telemedical advice service. They are based in Germany, in the lovely little city of Cuxhaven on the shoreline of the Northern Seas. And it was established in the early 60s, 70s, when there was only radio, like the VHF radio. When a captain on board a vessel had any medical problem, he could radio into the Cuxhaven hospital, and there was a designated doctor on call, and he would help and solve the problem of the captain. Nowadays, they're still active, but most of the doctors are not really into seaborne medical problems. They are from all over the world. They're not regional doctors anymore. They're more national or even international doctors. So they don't really know what's going on ships. So if you call them, you might have a specialist or you might have no specialist. And the TMS always is working case by case. So if you have a problem on board, they will solve the case and you sail on. MMS, on the other hand side, is a multifactorial company, we're not only talking about single cases, we try to sell the whole thing so that we have a look into the medical chest. We support the people on board, we support the people shoreside. So that's the main difference between the TMS and the MMS. So our approach is more for the whole company, the whole seafarers, the whole environment, and not only a case-by-case application. I guess that's the main difference between the TMS and the MMS.
Okay, perfect. Thank you very much. The next question is also very interesting. Sailing in malarious areas, what should be considered? I guess, Silke, this is a question for you.
Okay, yes, thanks. This is a very important question that comes often to me. Yeah, malaria is still a life-threatening disease which you can die of within a few days after the first symptoms. So yeah, you have to be prepared and you have to know a lot about malaria. So the risk of getting malaria depends on the length of staying in the risk area and also of the season in case of seasonal transmission, and also of the prevalence of the infectious mosquitoes. And last but not least, it depends on mosquitoes' ability to multiply and to transmit the pathogens to the human body. Unfortunately, there's so far no measure that offers 100% protection against malaria. So that's important to select and to combine the right measures to be protected as much as possible. The prophylaxis is based on two pillars. The one pillar is to avoid the mosquito bites. These you can achieve by wearing long clothes and applying an effective insect repellent on the uncovered skin. The other pillar is the drug prevention. Here you have to consider the current country-specific and, if necessary, also the season-specific recommendations and the time and duration of your stay in the risk area. You will find, or you can find, these recommendations, for example, on the malaria websites of WHO or CDC. For example, the recommendation for the stay in a high-risk area is the consistent use of the insect repellent in combination with the appropriate drug prevention. But also in a low-risk area, you should use the insect repellent as required. And since the shoreside medical help is not always available in a timely manner, you should also have a medication for a standby emergency treatment on hand. This standby emergency treatment should be used in case of fever, which develops 1 week or later after entering the risk area. And of course, you should seek for radiomedical advice. The symptoms of malaria are very unspecific. There's fever, you will feel awkward, sweating, freezing, chills, headache, body aches, nothing really specific. And a diagnosis is possible only, or a safe diagnosis is possible only after a blood test at a doctor. There are quick tests available, but the results are not always correct. So if in doubt, this standby emergency treatment should be started without further delay.
Mm-hmm. Okay, thank you very much for this. The next question I received is for Jens. Jens, would you recommend doctors to have an internship on a vessel to gain experience in emergency medicine when a fully equipped ambulance is not available?
It's most probably a question out of the medical audience. How to phrase it in a short manner. I think any occasion to a doctor is good for his education and development of skills, where he is forced to rely on his basic impressions and basic sense diagnostics to a patient, where he is limited in resources and is forced to prepare and to think about in advance possible emergencies or possible medical cases those can happen, and how to get them managed to the best of the patient with limited resources again. So there is no general question. There are not medical staff carried on commercial vessels, so that applies very much to cruise vessels. And indeed, I believe, and probably Aki will underline that, that is always a very good and a very lasting experience having worked on a ship.
Mm-hmm. And next question is also to you. Do you think it is possible to handle any case of medical issue on a vessel?
There is no clear yes and no. Indeed, I think as we have heard in the last session with the panelists, I think the most important is that the onboard staff reach some kind of a guiding hand of advice and help to how to manage a medical case. Handling an entire medical case on board a vessel, you can't definitely say a yes, because that's very much dependent on the disease and or the accident that happened. But at least it is possible by providing professional advice to the laymen are responsible to execute medical procedures on board, to guide them and to help them for the best of the crew, of the seafarer, and to the affected crew.
Mm-hmm. Okay, thank you very much. So I think the next question is for Silke. Is a medical chest based on your experience and recommendations for our ships still in compliance with the WHO regulations?
Yeah, well, I think this is a matter of reasoning. Because that mentioned list was influenced by the WHO regulation, but the list does not really contain every single item from the WHO. We had some reflections on the list, and we have cancelled a few unnecessary items and have substituted some old-fashioned items by modern ones and supplemented medicines we missed. But yeah, there are still some differences and there are still some items missed. In case of an audit or in case of port state control, if these changes were recognized, I think the shipping company should explain the reason and their intention to improve the medical standard, and maybe this will be accepted. But I think if the vessel requires a medical certificate according to the WHO regulation, at least the missed or the cancelled items should be added to be complete to the regulation, to be in compliance with the regulation.
Mm-hmm. Okay, thank you very much, Silke. Joachim, I think this is a question for you. Why are you insisting in getting the medical procedures on board vessels reviewed and updated?
Okay, and this is similar to Silke's answer. Medicine is going along, time is fleeting by, and we have to adjust to all new procedures. For example, the COVID-19 pandemic is a huge problem for seafarers nowadays. 2 years ago, there was no problem to go shoreside, have some vacation, have some relaxing time shoreside, to get some more power to go back to the ship. Nowadays, it's nearly impossible to go shoreside for being a seafarer. Therefore, we have to adjust a lot of procedures on board, not only for recommendation, for everything, like for hygiene protocols, for how to contact shoreside staff on board, We would like to keep the ship clean of any contagious disease. So it's a lot of problems just with this new pandemic. And we see that a lot of vessels still have some old kind of medical chests. They have old procedures. And once we're jumping in as a medical advisor, we like to update all these procedures to the normal common sense and to the normal high standards of today's medicine. That's why we're not only taking the case by case, but we also have a look into the whole procedure.
Okay, good. And the next question, yeah, Joachim, I would give you also this one. This question is a little bit additional to a previous one. Is every medical problem on board manageable, or when is the limit reached at which a disembarkation is unavoidable?
Okay, so this is a very difficult question. It is easily answered by yes and no. Obviously, you have to manage every problem on board. You just cannot say, oh, we don't do anything. So you have to manage the problem, whatever it is. And so we give the best we can do to support the captain or the medical officer on board to deal with whatever problem they might have. So this is very simple, but the outcome is not always simple. Sometimes the captain or the designated medical officer in charge just has his limits. Some accidents are so fatal that even a doctor and a medical team on board would fail. So the answer is no, we cannot manage everything on board, but we can always give advice to the crew on board how to deal with any situation. And just to come back to the question, how is it good for any doctor to go on board? Yes, it is good, because you learn that there is a different environment on board. You do not have the chance to call an ambulance. You do not have the chance just put the person into a bigger hospital. You have to deal with the situation on board. There is no escape. And once we're in the area of shoreside facilities, we easily try to evacuate the person, like we had on the other vessel with the arm we were discussing today with the hand injury. Once the vessel is in reach of shoreline, we can easily call in a helicopter to evacuate the injured person. And sometimes it's even better to send them home, because the full recovery of the seaman is our first goal. It's no point just to stitch them up and bring them back on board to continue with working on board. Working on board is a very hard job. And just to preserve the workload and preserve the value of the seaman, we should put them into their recovery and send them home for repatriation to get fully recovered after any accident or any severe illness. So the answer is yes and no.
Yeah. Okay, thank you, Joachim. What would you consider key elements to get medical care on board improved, Jens?
Let me refer to what we have spoken just in the last session. So the first one, when we talk about commercial shipping and having no medical staff on board, to me, the education and training of those officers in responsibility is definitely one of the key factors. And Irma, I just saw your question into the chat. I think that might answer it a little, because it is how we can ensure that they make a note early enough to avoid worsening of a potential disease or sickness. It is to get them treated, not only to treat, but either to recognize the early signs and to establish, let's say, an environment of trust where the crew members are willing and engaged to get to provide information about the current health status. That's the first. The second is that I think that it is nowadays a key factor that the staff on board has an address where to send their requests, their doubts, their findings, and their questions to, and reliably get answer and advice. And that leads immediately, from my perception for today, into a question we frequently lately face, let's say the very bad internet connectivity or connectivity at all from the vessels, so that sometimes even the mails are difficult to be sent. The next step is what Silke just mentioned, is indeed the medical chest. How is the ship equipped with regards to pharmaceuticals and to medical equipment that either the potential therapeutic measures can be appropriately executed, and all that a maximum of possible information can be reached by any advisor, so that the picture of the patient and what the real problem is can be drawn at its best. Because any advice is dependent on that. So being asked to me, there is education, there is medical equipment or the medical chest content, there is training and the connectivity of the ship.
Okay, thank you very much. This was also this is also a question regarding equipment. Silke, the medical equipment on a vessel, according to the EU or the WHO regulation, does that really matters?
Yes, you have to know that worldwide there are lots of different medical stores regulations, so national medical stores regulations. In the past, I've dealt with around about 30 of it, but only 5 or 6 medicines are included in each of this regulation. If you take a close look to the different regulation, you will realize they are different, there are different ordering systems, and they are differently up to date. Let me give you 2 examples. The WHO regulation is sorted alphabetically. That seems clear and simple, but if the officer in charge needs an agent against diarrhea, he has to know the name of the medicine. Otherwise, he has to go through all his shelves, looking for, reading each label, looking for a medicine against diarrhea, and then he will find the loperamide out from L. The European regulations are structured in treatment groups, and this makes it much easier for the officer in charge, because he will there's a group with painkillers, a group with agents for skin treatment, antibiotics, and so on. And here the officer can find the agent in the group gastrointestinal system, and it's much easier to get the right one in a short time. Some regulations were published more than 15 years ago. That means they are based on a medical knowledge 20 years before. But in the meantime, lots of new ingredients were developed, especially modern antibiotics and effective medicines with less side effects for heart disease or for hypertension. But once more, some examples. Some regulations are a bit older. The WHO one was issued in 2007, the Maltese one in 2002. The German regulation is one which will be updated almost every year. So perhaps, some listener will think also his medical chest is a bit old-fashioned. but he has to follow the flag state regulations and cannot freely choose the modern German regulation. But each regulation always reflects minimum standards, and each shipping company is free to add some modern and some effective medicines to increase the standard to an up-to-date level. And we would be happy to give you some recommendations on this.
Thank you. Regarding MLC, do you believe the MLC regulations are entirely applicable, Jens?
So let's say the important phrase in that area is that a seafarer should be able to reach the same level of medical treatment compared to a shoreside worker. And I think everybody is aware that this probably never will happen that way. So I think, to me, it is more, let's say, a headline, a challenge, or the question to bring the medical care on board ships as close as possible to that level. You won't be able to have on a vessel a CT scan or an MRI. I know there are some cruise vessels, they carry an MRI yet, but for the commercial vessels especially, that won't apply at all. But again, there are several developments in medicine, and especially in how remote and digital supported medicine can be provided and advice can be given. So to me, it is the question to the ship owners to get as close as possible by by evaluating the possible, applicable, and reliable tools to get this done. And this is something we are pleased to support with.
Okay, sounds good. Joachim, it's your question because we spoke this morning about medical devices on board. The question is, what kind of devices would you mean to be necessary on board?
Okay, another good question. From a doctor's perspective, it's always nice to have an idea about the vital signs. The vital signs is the blood pressure, heart rate, and the oxygen saturation. So that gives me an idea about how is the lungs are working, how is the heart working, is the patient well. So therefore we need a device to have the blood pressure measured. I guess this is standard on every vessel. And another device is the saturation. It's a small little device what is actually measuring the oxygen amount in the blood. It is not standard already, which is very, very sad because the device is around $30, $40. So it's not a big deal to get this on board. But it gives me as a doctor a very good idea how about the vital signs of the patient are. Is he saturated with oxygen or not? Especially in COVID times, it's a very, very important tool to have an idea if we have a really severe case on board, or is he able to stay on board in quarantine for the next couple of days. If we look a little bit further over the plate, we can actually get some more devices on board. An ECG would be a good idea if we have any problems with older seafarers. We see that we have a lot of people above 50 years on board. Because of the job, they might have not the best nutrition and they might have a lack of exercise on board. So they become a risk group of being cardiopulmonary disease. So if we have a potential heart attack on board, we can have an ECG to verify that. If we go even further, we might talk about little helpers, like we have sensors, they can measure this and this, and they're giving us an overview about the general condition of the patient. You can even go into little cameras where you have to look into ears and eyes and mouth. So we actually getting all our senses on the ship. So we not only talk to the person, we can see them, we can nearly touch them. We can talk about remote VR solutions that we actually help people on board with laptops or iPads how to do skills like putting up a cannula into intravenous flow. So this is what's on the horizon. So, but coming back to the question, I guess the vital signs is what interests us as a doctor most. So get a oxygen saturation on board, maybe getting an ECG on board. There are a lot of little devices which can help us to get a better idea what's wrong with the seaman.
Okay, good. Let's extend this round because I received a question right now. What was the worst case so far on a ship under the care of Marine Medical Solutions?
Shall I jump in? So there are three cases coming to my mind immediately. The one is a ship that was sailing from UK to Canada, and between Iceland and Greenland, they had very rough weather, and on deck, a crew member has been overtaken by a wave, and in the result, he has an open fracture of his upper leg, with, let's say, roughly 20 centimeters open wound. The bone was looking out, and the next port of call, even with increase of speed, has been 3.5 days away. So we have really guided the crew, I have to say, for the, let's say, stabilization of the patient, of the stabilization of the leg, and have accompanied them until they reached the area where a rescue helicopter came to the vessel and has disembarked the patient. The second is what in a completely different manner is what the case I have spoke about in the last session is, where after 4 days after having left Brazil on the way to Nigeria, a crew member suddenly developed a facial paresis with a suspect stroke, where it is quite heavy for the differential diagnosis and especially what consequences to be taken. And the last probably occurred just last week, where the captain of a vessel suffered COVID and got respiratory insufficient more or less from one moment to the other, with really severe signs of hypoxemia. So we had to organize and guide the second officer who was not as experienced to get his captain disembarked very quickly to make him survive. Let's take these three cases. Good as we had no fatalities so far.
Yeah. Dear audience, we can do this for the next 2-3 hours because we received a lot of questions for this, but anything got an end. So I would say thank you to all of you. Give the last words to Dr. Jens Tulsner, and hope see you soon. If you have any questions, contact us via the homepage, and I wish you a wonderful evening. Thank you very much.
Thank you.
Thanks, it was a pleasure.
So dear participants, dear audience, that has been a little exciting day for all of us as MMS. I hope we have been able to draw a picture how we see the current state and how we, or let's say what our vision is, how medical care on board ships might look like or should look like from our perception in the future. We have tried, or in the result, we have been able to keep it very short, hopefully not too short for you. So I can only underline what Sasha just has mentioned. Don't hesitate to get in contact with us if you have any further questions, if you need help, if you want us to support you. It has been a pleasure having performed this MMS Digital Day today. It was exciting and a lot of fun too. And I hope you enjoyed it as well. And we are looking very much forward to get in contact or to keep the contact we already have. Thank you very much and goodbye.